You'll find the spherical RBCs because you can see actually it's a biconcave shape. So whenever hemolysis takes place, you can understand the number of RBC size is decreasing. So this all the contents in the RBC are decreasing and they are moving towards one side and becoming like this spherical. So that's it. Now in the IgG, the opsonization takes place mainly in the IgG. On the cell surface, when something is added, it increases the phagocytic or macrocytic effect. In the case of IgG, there is extravascular hemolysis in the IgG. So opsonization, in the cell membrane, extravascular means outside the blood vessels only. It is occurring, but in the case of IgM, you can understand as agglutination is taking place, it's taking place, hemolysis is also taking place intravascular inside the vessels. So Coombs test is nothing but antigen antibody reaction test to detect the presence of anti-RBC antibodies and complement components mainly by using Coombs reagent. So what is this Coombs reagent? If we remove the IgG and complement components from the circulation and inject them to the animal, then the animal makes the antibodies against these components and they form the antibodies along with the antibodies of complement compounds, and now this is put in a bottle and it is said to be Coombs reagent, and generally they are polyclonal antibodies, not monoclonal. There are mainly polyclonal antibodies, and these antibodies are called anti-human globulins or AHG in short form. So polyclonal antibodies are mainly derived from different plasma cells, and antibodies against the human antigens are nothing but the Coombs reagent. So you can see the monoclonal antibodies are also produced by selecting some specific cells from animal plasma cells sometimes. So multiple myeloma, it is a neoplastic cell proliferation of plasma cell. So sometimes we may add this cell to monoclonal antibodies to form a specific type of cell. That is, it is having a neoplastic proliferation, means it has the capacity to highly proliferate, and we have taken already the monoclonal antibody, that is a antibody against the RBC. So plasma cell of animal is attached with or added to the multiple myeloma cell of animal together form the hybrid cell. This is called as hybridoma, and it is the cell which have the characteristic of both to produce the antibodies against the human cells and also have a high replicative capacity now. So this is how we form different hybrid cells. This is also called as hybridoma. So hybridoma is now a monoclonal cell and it is a combination of plasma cell along with the multiple myeloma cell. So Rh antigen has mainly 12 pass membrane and polyclonal antibodies attack of specific epitopes of a antigen. And direct Coombs test, now let us see what is direct Coombs test. So if a person has autoimmune hemolytic anemia, so their RBCs have auto RBC antibody. So first step here, the antibody is IgG, and we should wash the RBC to remove the extra plasma components, and finally only the antibodies are left. Later we add the Coombs reagent, so which have the antibodies against the human antibodies. So the Coombs antibodies react with the antibodies of human form and human cells and form a clump or react. So this cross-link agglutination is formed. So autoantibodies are present. So we can say it is a positive direct anti-globulin test is positive. Here the direct test is positive. For example, you can understand they're having some autolytic disease, means they have antibodies against our body. So if we add, for example, you can see this is that RBC and they're having antibodies against our cells. Right, so this along with our Coombs reagent. In Coombs reagent, you can understand they have one specific big antibody. So this comes and clumps with them like this. So they form a clump. If the clump is present, it's said to be positive test, means we can say that there are presence of autoantibodies. You can understand if there are no autoantibodies, only the cell remains, we have the Coombs reagent, then only it forms like that. It can't form a clump. Then we'll say it is a negative. If it is negative, we'll say the disease is not present, and if it is positive, we'll say the disease is present. So this is how we use this test to follow. And in unaffected person, that is without antibodies, then there no clump or no agglutination, then it is direct antiglobulin test is negative. So we will continue our next part because our video is getting longer. So we'll continue its part 2. We'll continue our direct Coombs test. So if the antibody is IgM, So if you remember, IgM is mainly present our ABO blood group system. It forms the agglutinogens, right? So if the antibody is IgM, then activates the complement C3b, and this binds to the RBC, and IgM leaves the RBC. So only the C3b is now present with RBC. So now when this is reacted with the Coombs reagent, then it produces the anti-complements and agglutination forms, and the test is positive. Yeah, we know whenever you see the IgM, then only you can understand the test will be positive because it forms a clumps. And example, you can see the drug-induced immune-mediated hemolytic anemia, and also in the post-transfused hemolytic anemia. In these conditions, you can understand in post-transfusion, if we transfuse some abnormal types, like for A group person, if we give B group blood, then it will also lead to hemolytic anemia, and because of some drugs also it may cause this. So this is like causing the direct Coombs test positive, because here the agglutination or clumping process will take place. So okay, if we draw and understand this, it is very easy. So for example, this is our IgM antibody already against this antigen. This is RBC antigen, right? So against this antigen already we have antibody. So along with this, if we add the Coombs reagent is like this. So you can understand already this both, and this Coombs reagent now forms like this, and confirm the clot is formed, or we can say the clumping is formed. So this is the positive test. So immediate post-transfusion hemolysis, when donor's RBC enters the recipient, then the recipient antibodies affect the donor's RBC. We are seeing it from long time under the attack. So they have intravascular hemolysis of donor RBC in recipient body. This case is seen mainly intravascular only, can understand. It is mainly seen only in IgM. In the case of IgG, we will see the extravascular hemolysis. Here intravascular hemolysis, because you can understand the donor blood is coming like this and a recipient antibody. So both are present exactly at the site of vascular system. So here for sure the blood will undergo the process of hemolysis. Hemo means blood, lysis means breakdown of red blood cells will for sure happen intravascularly in the case of IgM. So if you understand the concept, it is not hard to remember all these things. So anti-RBC antibodies are mainly of two types. We have seen already, allo type, auto type. Allo means, in the case of A blood group, they form anti-B, means they are not forming the self antigen antibody, right? So this is allo against the donor antigen, right? Auto, against the own RBC only they are forming the antibody, that is called of auto. So erythroblastosis fetalysis, or immune mediated hemolysis of fetus or newborn, we know this newborn baby. So here we have a Rh negative mother with a Rh positive baby. So the fetal maternal hemorrhage occurs during delivery, because so when some of the blood always mixes with the mother and fetus. So now what happens, the IgG antibodies can reach the placenta. Here in this case you can understand we are talking about IgG. If you are talking about IgG, you can understand we are mainly talking about the Rh blood group system, right? So whenever we say IgG, it is related to Rh. Whenever we say IgM, it is always related to ABO blood group system, right? So IgG cross the placenta, but IgM can't cross the placenta. IgG, it stores the all infections from our mother which are taking place from many years, and it gives a immunity to the baby. It's like a gift to the baby. IgG, G for gift. So it's a gift for the baby. It can cross the placenta, because but here it is not a gift. In this case, in this embryoblastic fetalis, it's not a gift, because here the IgG antibodies can cross the placenta and attack the second baby, because here the mother is Rh negative and the baby is Rh positive. You can understand, in the case of Rh negative mother, because of mixing of Rh positive blood, she will form anti-Rh positive antibody. So this anti-Rh positive antibody will affect the second baby, because second baby is also Rh positive, and that blood cells in a baby will destroy, and this destroyed blood cells, you can understand, they'll convert into mechanism of red blood cells, they'll eliminate in the form of bilirubin. So this bilirubin now can't excrete out, because of lot of RBCs are getting hemolyzed, and the capacity of liver means lot of liver is not having even enough time to excrete it out. Of course they will excrete after some time, but if the hemolysis is so severe, then the bilirubin gets filled in the body, and this leads to jaundice in a newborn baby. And if in the case, here is in the situation also, Coombs direct test is used by taking a cord's blood and test it. So remember, here also we take cord blood, means umbilical cord blood. If we take of a baby, you can understand in the baby already there are antibodies against our RBC of the baby. So this is the RBC of the baby, and these antibodies are from the mother. So this antigen antibody along with our Coombs reagent, they will again form the agglutination first shoot. So this will also be a positive test. So these are all the direct Means you can understand here directly only one step process. First we are taking the RBCs which are already attacked by the antibodies, and now we are adding one more antibody from an animal, that is anti-antibody. Means against this antibody we are having one more antibody. So now they will easily form a clump. So this is only one step process, direct process. So we have seen these examples in direct process in the case of cord blood in the Rh negative mother, and we have also seen one more like drug induced hemolytic anemia, and also post transfusion hemolytic anemia. So these are all the examples of direct anti-globulin test is positive. Now let us see the indirect Coombs test and understand it. So indirect anti-globulin test is also short from IAT. Here the antibodies are freely circulating in the plasma, and we should do the, if they're freely circulating in plasma only we should do this. You can understand now. For example, as we are saying, recipients antibodies will always not attack, sorry, uh, recipients nahi, donors antibody will not attack the recipient's antigen. That's what we are talking before, because they're freely fusing, they're freely flowing in the plasma. So that example comes here in the case of indirect Coombs test. So antibodies freely circulating in plasma, we should do the indirect test, but in a direct test we do when the antibodies are directly attached to the RBC. So in the name only can understand. Direct test means only when it is done when the antibodies are directly attached to RBC. But here indirect means indirectly there means the antibodies are flowing in the plasma, but they are not directly attached to the RBC. So you can understand it is done attached to RBC, which is in vivo, means it is outside not inside. So you can understand that the direct test is in vitro and indirect test is in vivo. So for examples here in the case of indirect Coombs test we have pre-transfusion testing, ABO compatibility and RH compatibility. So before giving any blood transfusion to a patient we do pre-transfusion test with the indirect Coombs test. So for example here ABO compatibility means for example, RH compatibility, we know already this negative mother with positive baby. So if we take the mother cells, they're always negative RBC already present, and if we bind this indirect Coombs test with it, then it forms anti-RBC. Uh, we'll see that, we'll understand it. And also we do prenatal testing. So all this comes under the indirect Coombs test. Let us see them. So pre-transfusion test done before the transfusion that the recipient antibodies don't attack the donor's RBC antigen. So first we need to wash the donor's RBC and add the recipient serum with the antibodies, and in vitro sensitization of RBC is done. That is nothing but indirect test. Coombs reagent, that is anti-human antibodies, and agglutination is seen, so test is positive. So what we are doing, first we need to take the donor's RBC. So we need to wash the donor RBC and add the serum with antibodies. So you can see in the second step we are adding antibodies, but in the case of direct you can see already they are attached to the antibody, but here we are again taking the antibody and adding it. So it is an indirect Coombs test because it is involving two processes, two-step process. So let us compare both this direct test and indirect test of Coombs. So direct test is always in vivo and indirect test is in vitro. Sorry, before I said reverse. So direct test is in vivo, indirect test is in vitro. And here RBC and antibody are already present. Here now RBC, the sensitized antibody is added later, and it is inside the body, that is intravascular hemolysis is going on, and antibody already attached to the RBC. Here outside the body, and it is not attached because this process we are doing outside the body. Already this direct test means already antibodies attached to the antigen inside the body, and now we are adding the Coombs test. But here in the indirect case it is done outside the body. Just we take the cell of RBC, and now outside the body we will add the antibodies. So this is outside the body. So thus the test also called cross matching or antibody screening. So if the test is positive then we need to not transfuse the blood. Yeah, because if the test is positive we can understand it is having some incompatibility properties, so we should not stop the transfusion. So prenatal testing also we can do. For example, like here already we know this Erythroblastosis Fetalysis, Rh negative mother with Rh positive baby, so she have anti-Rh antibodies in her body. So test is serum from the mother along with the reagent RBC Rh positive. This is anti-Rh, commercially available, sensitized in vitro. So here we take the reagent Rh positive. We are saying that we are not taking, this is prenatal test, means the serum is taken from the mother with the anti-Rh, and here we are having Rh positive cell, means antibodies taken from the mother, anti-Rh antibodies taken from the mother, and we are taking the positive cell. Here we are not using directly baby cell, we are taking some commercially available Rh positive cell. So here agglutination of course takes place. Here the indirect test will be positive because this antibody now goes and attacks. So it is a sensitized antibody now, and this gives an indirect test positive. So was the RBC sensitized, Coombs reagent is added against anti-human antibodies, and of course agglutination takes place and the indirect test is now positive. So this is how we do this indirect test. So if there is no anti-RH antibodies or commercially available RH positive RBC and non-sensitized plus Coombs reagent, then no agglutination. So we'll say here IAG negative. So no problem to the baby in the fetus to be delivered. So there also sometimes you can understand, always it may not be positive. Sometimes some mother may don't have anti-RH antibodies. She may be like both baby and mother baby together RH negative, or together they may be RH positive. Then in that case there will be no problem. But if the mother is RH negative and baby is RH positive, that will only cause the test to become positive. So you can understand there are also negative cases when there are both are equal. So now let us compare the direct test and indirect test. So you can see that in both the reagents are Coombs, and here already pre-attached RBCs are better, but here the post-attached or free circulating antibodies attached to the RBC and sensitized in vivo, but this is taking place in vitro indirect. So first step is procedure like RBC should wash, add the Coombs reagent. Here the is a two-step procedure, only one step direct step. Here the two steps are used. First the serum added to the reagent RBC, next we have the Coombs reagent. So here directly we add the Coombs reagent in the first step itself. So example, here we have autoimmune hemolytic anemia, drug induced hemolytic anemia, clots bled fetal baby, cord blood taken from baby, hemolytic disease of fetal or newborn, and post transfusion hemolysis, and done more commonly. And you can see here examples are pre-transfusion test, antibody screening, recipient's serum plus donor RBC, prenatal test in RH negative serum of mother. So here we do the test in mother, indirect one, but direct one we do in the baby's cord cells. So that we need to remember. And this is the most common one, because direct is very easy and convenient, and indirect is less common test. Also we do this, but less common. This is the most common one. And the patient blood is centrifuged and the anticoagulated. So remember that in the case of direct Coombs test, it is anticoagulated. It is anticoagulated means, you can understand, if it's centrifuge, anticoagulated means because of centrifugation the plasma floats upward and RBCs come downward. So here in this test, because here already RBCs are attached with antibody, so it should be anticoagulated. If it is coagulated, how can we test for the antibody? Because already we need to take the preformed, pre-attached RBCs, so it should be always anticoagulated. But here it is non-anticoagulated, means it is coagulated. Why it should be coagulated? Because now here we need to take the serum. Serum also contains antibodies, right? So here we need to take the serum. So always remember that serum comes only from the coagulated blood. In an anticoagulated blood we get the plasma. Serum is also a component of plasma, but after coagulation the remaining part is the serum. Even serum contains the antibodies. So the non-anticoagulated blood is used, that is let the blood clot, and remaining fluid is the serum. So from the serum we get the antibodies. So that antibodies we will add with our RBCs, and also we'll add the Coombs reagent. So it is two-step process. It's the indirect test. So first we should understand some of the important points also related with the blood, and we'll complete this. Next we will move on to RH blood group system in another video. So here we will do this coagulation. So coagulation is always is a plasma component. Also coagulation may takes place in the whole blood, but coagulation alone can also takes place in the plasma. That is, here insoluble fibrinogen is converted, soluble fibrinogen is converted into insoluble fibrin. And clotting takes place in the whole blood. So coagulation only in the plasma, it's a fluid, it converts into semi fluid mass if it undergoes the process of coagulation. But clotting can take place in the whole blood, that is whole blood can undergo the process of clotting. Remaining fluid here is also called as serum. So when clotting takes place of a whole cell, remaining part is called as serum. And plasma, so that we can say that plasma is equal to coagulation factors plus serum. So you can understand, in serum after coagulation the remaining formed part is serum. So in serum you can understand there are no coagulation factors, but in plasma there are coagulation factors. So that is the difference between plasma and serum. Once again, plasma have the coagulation factors, but the serum don't have the coagulation factors. And you can see the plasma is equal to coagulation factors plus serum, or another way you can write the serum is equal to plasma minus coagulation factors. That's it. So clotting is equal to WBC plus RBC plus platelets plus fibrins plus plasma plus serum. And coagulation factors mainly coagulate. And agglutination, what is agglutination? Is a clumping of particles in antigen antibody reaction. This is known as agglutination. So these are the basic terms which are always used interchangeably, but they also have some specific definition, and they have some specific roles where those processes occur. So this should be given importance, because everyone use them, think them as same process, but they also have some different meanings and different processes. So this we need to check out. So this is about our today. In the before video we completed direct Coombs test half, and here we continued the direct Coombs test and indirect Coombs test we completed. Next we'll move on to the RS blood group system. That is very simple.